Welcome back to Close Up. Lynn Blankenbecker left the campaign trail earlier this year to serve on the front lines of the COVID-19 pandemic in New York City. Now she's back in CD2 and looking to win a rematch this year against Steve Negron, the Republican nominee in 2018. Lynn, thanks for joining us this morning.
Thank you, Adam. It's a pleasure to be here. I appreciate it.
So this last week, the president tweeted out a question floating the idea of delaying the 2020 election due to concerns over potential voter fraud. He can't do that, but an act of Congress could. Do you think there are any circumstances under which an election in the United States like this should be delayed?
No, I don't think so. I think our Secretary of State, Bill Gardner, had it right when he said, we fill out our ballots with a pencil, and I think everything's going to be fine. And we definitely, I don't see any need to delay the election.
And the president continues to suggest that absentee voting is wide open to fraud. Do you agree?
Well, I've been an absentee voter in the past. I think there's a difference between mail-in ballots and absentee voting. I've had to absentee vote as a military member. When I was in Afghanistan, I had to send in my absentee ballot. There's a process for that. You write to your city, to the clerk's office. They send you a ballot. They verify it as you. You fill it out. You send it back, and there's a verification process. So I think for those folks in our communities that feel like they need to absentee ballot, that's a good thing. I don't agree with mail-in voting.
And what would be the opportunity for fraud with the mail-in? Because obviously you're, attesting on that envelope to who you are. It seems like there's even more levels of security to the mail-in than there are to in-person, at least would be in New Hampshire anyway.
Well, not really. I mean, when you look at some of the households that have already received mail-in ballots from those areas where they're doing that, 3 and 4 ballots will show up at a home for somebody who doesn't even live there. And there's this opportunity for you to be able to fill that ballot out. Or, some homes have reported that they received 3 and 4 ballots to the member that lives there. So, for example, I could get 3 ballots. And is anybody putting a check on that to make sure I'm not voting 3 times or however many ballots I get mailed?
Let's shift to the pandemic. Do you believe President Trump is doing a good job handling COVID-19?
Absolutely, absolutely. I served aboard the ship and I saw the president's response to it. There were a lot of lessons learned in this pandemic, and I think that we can learn from those and move forward. We definitely had flawed models, and those models did cause a lot of panic and a lot of reaction to that. Adam, when I was at the Pentagon, we used to prepare for this very thing from a medical perspective, whether it was a nuclear attack on our nation or a chemical attack or a biologic attack on this nation. And we did a lot of tabletop drills on that. We never ever once talked about a toilet paper crisis. But, as far as being able to predict and determine just how bad this is going to be, it's very hard to do. And so I think the models were based on flawed information. We need to get more information as we move forward and adjust accordingly and put measures in place to protect America using current data and current information.
So you're saying essentially that you believe the fear of the virus has been worse than the virus itself?
Well, I'll just give you my own personal experience when I was in New York City. When we brought the ship there, the reason we brought a 1,000-bed ship with a bunch of ventilators was because there was a belief that there weren't enough beds available in New York City, and that wasn't the case at all. That is why the ship left after a month. They didn't need our beds. What they needed were doctors and nurses, and that's where President Trump really rose to the occasion. I'm a nurse in New Hampshire. And if, let's just pick a state, North Dakota had a crisis and they needed healthcare providers to go take care of people in North Dakota, up to this pandemic, I wouldn't have been able to just jump on a plane or get in my car and go help the people of North Dakota. But now, because they've broken down that regulation and said, your license is good in New Hampshire, you are a nurse in good standing, and you meet the credentials and qualifications to be a nurse in New Hampshire, let's get you to point of care now. Those people are sick today, not in 6 months after we can work through the rigmarole of getting you licensed there. So that's exactly what happened in New York City. President Trump was able to break that barrier down, and then the Expeditionary Medical Unit and the Army Brigade that came after the ship got there were able to put our medical doctors and nurses right into those city hospitals in New York City so that they could take care of the patients.
And in your service there in New York City, you ended up actually testing positive for COVID-19. What was that experience like?
I did. Well, and I think I probably exhibited the symptoms that most people, the majority of people who end up with COVID, get. And for me, I had a runny nose and I lost my sense of taste and smell for a few days, maybe a week. That was the extent of my symptoms. At first, honestly, because I didn't see that as being the virus, I thought, well, maybe my positive was false. But now I've learned that I have very high antibodies. So public service announcement, if anybody needs antibodies, I do have good, strong antibodies. But now because I had a positive COVID test, I did have those minor symptoms and I do have positive antibody. It's clear I did catch COVID. And so but I didn't experience the extent of those symptoms that some people were unfortunate enough to end up either having extreme hospitalizations, ending up on ventilators, or, unfortunately, some people did die from the disease.
We'll have to check in with the FEC if the antibodies count as an in-kind donation. But will you be taking the COVID-19 vaccine when it comes out?
Probably not. I think it's rushed to market. I am in the United States military, and the military can compel us to take vaccines. I don't believe in rush to market vaccines. Adam, when I first became a nurse in the 1980s, AIDS didn't have a name. And we were working on taking care of patients. And back then, we used to suit up like we were going into a nuclear reactor to do simple procedures on patients. And so we've learned over time. But, we still don't have an AIDS vaccine, and that was 40 years ago. And so I think we have to be very deliberate, and there has to be plenty of science behind it. This is a very new virus for us. And when you look at the fact that, let's say December, when we first had any knowledge of COVID, and here we are only 7 months later into July, and that's a very short time to test. I just read the studies yesterday that they are in the third phase of trial for 30,000 people. 15,000 of those are getting placebos, and the other 15,000 are getting the vaccine. And so I think it's a little premature.
So if you're the Congresswoman from New Hampshire in 2021, would you be urging your constituents to also take caution when it comes to a vaccine, potentially advising them just not to take it?
I will advise my constituency to do what it feels right is best for them, what they believe is. I would hope that folks are out there doing the research, that they're looking at, all of the research behind it, looking at the data, and they're making that decision for themselves.
We'll shift gears here to another major topic of the last few months. What's your perspective on the Black Lives Matter movement? Do you believe it's a force for good?
So there is no doubt that we have to pay attention, and we absolutely need to listen to what's going on. This is a movement that's been coming. It didn't just start with George Floyd. It goes all the way back to 2013. I think with Trayvon, and we've seen this sort of brewing and bubbling up as time to time goes. I want to make it abundantly clear that I don't feel like we needed to defund the police. Police are very important and vital, and I have huge respect for our folks in law enforcement, and so I don't want to see a defunding of the police as a result of this. But folks want to be heard, and I have worn a uniform for 34 years to protect and defend our Constitution in the United States. And part of that Constitution is folks' freedom to assemble and folks' freedom to voice their opinions. And the peaceful protesting of groups who want their voices heard is something that our Constitution protects. Now, those who tip over into the violent protests, arson, that's against the law. We are a land of laws, and they should be held accountable to the fullest extent of the law. Vandalism, same thing. Clearly, assault and attacks on our police officers, absolutely don't support that.
All right, Lynn Blankenbecker, thank you for joining us on Close Up New Hampshire. We'll catch you out there on the trail in CD2.
Thank you so much, Adam. Have a great day.
You as well.